Obesity is an epidemic in the United States. It's a concern for public health officials, but also for risk managers. Overweight workers can complicate on-the-job injuries and extend the length and cost of workers' comp claims. Here to discuss ways to manage the obese and injured worker is Kevin Glennon, Vice President at One Call Care Management. Kevin, welcome to the program.
Thank you.
So Kevin, we know obesity is a problem in the US, but just how bad is it?
Right now, estimates are approximately 42% of our population is considered obese. And by 2030, we're looking at excess of 51% of the population will be overweight or obese.
How does obesity affect workers' comp claims?
When you look at a work comp claim, obesity and the comorbid factors that are generally associated with that, hypertension, poor circulation, heart disease, lead to longer recovery times. With longer recovery times, you have increased medical expense and increased indemnity.
So managing obese and injured workers is a tricky scenario, no?
Oh, most definitely. You really need to be extremely proactive dealing with the injured worker with the comorbid factors that are associated with obesity.
So what can a risk manager do to control costs associated with these workers' comp claims?
Being as proactive as possible with these injured workers, understanding any and all comorbid factors up front. I always say an ounce of prevention is worth a pound of cure.
Are there ways to help prevent the claims in the first place?
Yes, by promoting a healthy work environment, we can implement programs for weight reduction, preventative health care, looking at hypertension, and various other conditions that when an injury occurs, prolong recovery times and increase indemnity.
Interesting discussion, Kevin. Thanks ever so much for joining us.
You're welcome. Thank you.
And if you'd like more information on management of costs associated with the obese and injured worker, visit the One Call Care Management website.